My name is Ray Bertino, B as in boy, E-R-T-I-N-O. I'm a retired physician and MD, and since retirement I've been working on substance abuse issues. Marijuana was not even on my radar screen. What I was working on was opioids. About a year ago, it became apparent to me that Illinois was serious about legalization of marijuana, and I started to look into it. And after looking into it and researching it, I know the medical literature, it's not a good idea. If you look at British Journal of Psychiatry, an editorial from 2018, what they say is that the United States is running an experiment on their population. We should wait to see what the results of that experiment will be before we do any change in our marijuana laws. That's what the Brits think about what we are doing. Marijuana will bring in money, but it won't bring in nearly enough money to solve Illinois' pension debt. Now, all of you may know that, but the populace, a lot of the populace doesn't realize that. The amount of money it will bring in is minuscule compared to Illinois' pension debt. That's unfortunate, but it's very true. You don't hear people talk about it, but it does not solve Illinois' budget or money problems. The states that have legalized have had problems. Particularly, let's talk a little bit about Colorado. Emergency room visits for marijuana are up, way up. They're up 10 times for kids under the age of 10. Some of those have resulted in ICU admissions. For adolescents, the visits are up fourfold. And for adults, visits are up fourfold over only 4 years. That's from Annals of Maternal Medicine just 2 months ago, March 2019. Visits are up fourfold. Now, is marijuana going to help poor people? Absolutely not. Who do you think those adults were who were visiting the emergency room? 2/3 of them were either on Medicaid or had no insurance. Marijuana is not going to help the poor. The other thing, I'll be happy to answer questions when I'm all done. The other thing is that pregnant women in Colorado, this is University of Colorado data, pregnant women in Colorado are using marijuana at a higher frequency than they used prior to legalization. This has resulted in more premature births and in decreased fetal weight. This isn't me saying this. This is University of Colorado obstetrics department who said this earlier this year. So it has not been good. What is more, marijuana dispensaries both in Colorado and Washington are known to be located in poor neighborhoods. That is where they get located, just as liquor stores get located in poor neighborhoods. Is that social justice? Is selling candy marijuana social justice, where you appeal to the children? What we don't need, if we're going to legalize marijuana, the smart way to do it is a non-commercial way. Like Marty said, it's to sell marijuana in brown paper bags at Walgreens and at CVS. As Uruguay does, or as Quebec is planning to do. It's not to make new industries where the sole focus of that industry will be to sell as much marijuana as possible and to get as many to use as much marijuana as possible. You have to realize the average marijuana user is a heavy user. 80%, this is according to Jonathan Calkins, professor at Carnegie Mellon, a public policy expert well known on drug policy. 80% of the marijuana that is used in this country is used by people who smoke every day. 80%. That's 8 million people in the United States who smoke every day. In addition to that, there's millions of other heavy users. If you look at the marijuana that's used by daily users or heavy users, it's 98% of the marijuana that's smoked in the United States. And this is not me saying it. This is Jonathan Calkins, who had an article in National Review a couple of years ago. I don't believe Jonathan Calkins is conservative. I've never talked to him, but he's written many public policy papers, and he's a national expert on drug policy. Bo Kilmer had an editorial in New England Journal of Medicine 2 years ago, 2017, where he says there are many non-commercial ways to legalize marijuana. If you commercialize it, you are just forming companies who will want to sell as much as possible and have people use as much as possible. It's not good for the public health.